So beta atopic asthma is basically a type 1 hypersensitivity reaction. The disease usually begins in childhood and is triggered by environmental allergens such as dust, pollen, cockroaches, animal danders, and food. Okay, and which acts synergy with other pro-inflammatory environmental cofactors, mostly with respiratory viral infection. So the diagnosis of asthma, a positive family history. With a positive family history is very, very important. And it is common, and skin test with offending agent in these patients result in an immediate wheal and flare reaction. Clear? The diagnosis of asthma can be made on the basis of positive family history. There is a positive reaction, skin test positive, which shows a immediate wheal and flare reaction and high. इधर आइए ना ओ स्क्रीन से तो कहाँ गई So high total IgE level in the serum are present in these patients or evidence of allergy sensitization by test. Okay, high IgE level, positive family history, positive skin test, which shows the immediate wheal and flare reaction. These all tests are used for the diagnosis of asthma. And the second type is non-atopic asthma. There is no evidence of skin sensitization and skin tests are negative. Positive family history is less commonly seen. Respiratory infection due to viruses are common trigger in non-atopic asthma. Okay, means the no family history, no skin test positivity is seen, but the respiratory infection provoke the development of asthma in these patients. Okay, and inhaled air pollutants such as smoking, sulfur dioxide, ozone, and nitrogen dioxide may also contribute to the chronic airway inflammation and hyperreactivity in some cases. Sometimes the attacks are precipitated by exposure to the cold and exercise. Clear? So, beta, till now, you must know about what is asthma, okay? What are the different type of asthma, okay? What is the difference between the two types, atopic and the non-atopic type? In atopic type, family history is positive, no family history. In atopic type, there is a skin test is positive, no evidence of skin sensitization is seen in non-atopic type. It is mostly seen in childhood. It can be seen in adult. There is allergen to other allergen also, but there is it is mostly provoked by our respiratory viral infection or cold or exercise. Clear? Now, the drug-induced asthma may be seen by means of aspirin sensitivity. Asthma is seen in individuals with recurrent rhinitis and allergic pollen. These individuals are sensitive to penicillin and NSAIDs. Okay, means drug-induced asthma is mostly caused by aspirin and NSAIDs. These drugs trigger the asthma by inhibiting the cyclooxygenase pathway. Beta, please, you must know about this, that this is responsible for the development of drug-induced asthma. Because that these drugs, like aspirin, like NSAID, these drugs inhibit the cyclooxygenase pathway, which leading to a rapid decrease in prostaglandin E2 level. Okay, these drugs causes decreased cyclooxygenase pathway by decreasing the prostaglandin E2 level, and these prostaglandin E2 inhibit the enzymes that generate the pro-inflammatory mediators such as leukotriene B4, C4, D4, and E4, which have a central role in aspirin-induced asthma. Okay, whenever there is a decreased level of prostaglandin E2, so there is a no inhibit enzymes, and so there is an increased level of leukotrienes, and these leukotrienes then causes the inflammatory response in asthmatic patient. Clear? The occupational asthma. This type of asthma is induced by fumes, organic and chemical dust, gases, and other chemicals like formalin, like penicillin chlorides. Type 1 hypersensitivity reaction occur with direct liberation of bronchoconstrictive substance and hypersensitivity responses to unknown origin. Clear? Now, the pathogenesis of asthma, how asthma occurs. What are the changes seen in asthma? Basically, atopic asthma is caused by type 2 helper cells, type 2 T helper cells, and IgE responses to environmental agents in genetically predisposed individuals. Okay, there are there are role of a certain things like immune response, like genetic factor, like environmental factors. These all contribute in the development of asthma. I repeat again, there is a role of immune, genetic, and environmental factor. These all combine affect for the development of asthma. Now, the immune response. But a fundamental abnormality in asthma is exaggerated by type 2 helper T cells, type 2 helper T cells. Response to normally harmless environmental allergen in genetically predisposed individuals. Okay, type 2 helper T cells secrete cytokines that promote the inflammation and stimulate the B cells to produce IgE and other antibodies. Clear? Means you must know that there is a role of immune system, and it includes type 2 helper T cells, and these helper T cells then causes the production of IgE. Okay, the cytokines. So beta, this is very, very important. Okay, if anyone asks about the pathogenesis of asthma, you must know about these three names. Okay, and you must know their function. Okay, actually, there are different type of cytokines like interleukin 4, 5, and 13. Okay, in asthma, three interleukins: interleukin 4, 5, and 13. Okay, interleukin 4 causes the production of IgE. So interleukin 4 causes the production of IgE, and there is an increased level of IgE. Interleukin 5 causes the attraction, recruitment of the eosinophils. So there is an increased level of eosinophil in asthmatic patients. Okay, and interleukin 13 is responsible for increased mucus secretion. Clear? I repeat it again that in asthmatic patient, if anyone asks about the pathogenesis of asthma, you must write there are certain roles of immunological mediators, genetic, environmental. Okay, immunological factors. There is a role of type 2 helper T cell, clear, and cytokines like very, very important 4, 5, 13. 4, 5, 13. In 4, the interleukin 4 is responsible for increased IgE level. Interleukin 5 is responsible for increased eosinophils level. Interleukin 13 is responsible for increased mucus production, mucus secretion. Clear? So these three play a major role for the development of asthma. Okay, and the T cells and epithelial cells secrete chemokines, and IgE binds to mast cell. Repeat exposure to allergen triggered the mast cells to release the granules and produce cytokines and other mediators, which collectively induce the early phase reaction and late phase reaction. So now the mediators implicated in asthmatic response are divided into three groups: first group, second group, and third group. The first group includes leukotrienes and acetylcholine. Okay, mediators are divided into three groups: first, second, and third group. First group includes leukotriene and acetylcholine. Leukotrienes include C4, D4, E4. Clear? And these leukotrienes, which causes the prolonged bronchoconstriction, increase vascular permeability, and increase mucus secretion. Clear? You must know that there is a role of leukotrienes, and these leukotrienes causes the bronchoconstriction, increased vascular permeability, and increased mucus secretion. Clear? And in first group, acetylcholine also play a role and released from the intrapulmonary parasympathetic nerve, which can causes the airway smooth muscle constriction. Clear? Now, the second group. Beta, the second group includes histamine, prostaglandin, D2, and platelet activating factor. Clear? Three groups of mediators: first group, second group, third group. In first group, leukotriene, acetylcholine. Clear? In second group, there is a prostaglandin, platelet activating factor, and histamine. Histamine causes the bronchoconstriction. Prostaglandin D2 causes the bronchoconstriction and vasodilatation. And platelet activating factor causes the aggregation of platelets and release of serotonin from their granules. Clear? And the third group includes the interleukin 13, 14, 1, 6 chemokines. Clear? So, till now, beta, if anyone asks about the pathogenesis of asthma, then you must know that in pathogenesis of asthma, there are certain rules of immunological response, genetic response, and environmental response. Clear? In immunological response, there are main is type 2 helper T cells. Okay, type 2 helper T cells, and there are certain chemokines like interleukins. These interleukins 4, 5, and 13. 4 causes the increased IgE level, 5 causes increased eosinophils level, and 13 causes the increased mucus secretion. Clear? Then there are three types of three groups. One group includes leukotrienes, acetylcholine. Second group includes histamine, prostaglandin, platelet activating factors, and third groups include interleukins. And these all mediators are responsible for the development of bronchoconstriction, for the development of increased mucus secretion, for the development of increased IgE level, for the development of increased eosinophils level. And we all know that these all, like bronchoconstriction, IgE level raise, increased eosinophils, increased mucus secretion, these all are the features of asthma. Clear? Now, the genetic susceptibility. Beta, susceptible to atopic asthma is multigenic and is associated with allergic rhinitis and eczema. Susceptible locus for asthma is on chromosome 5q. Okay, keep it in your mind. Asthma agar hai, so chromosome 5q. Okay, and particularly class 2 HLA allele. Okay, are linked to the production of IgE. Genetic की बात आ गई, 5q chromosome आ गया, and class 2 HLA allele आ गया. Okay, and beta, this is very important, is ADAM33, polymorphism in gene encoding ADAM33. You must write if anyone asks about the pathogenesis of asthma, then in genetics, there is a role of chromosome 5q, and there is a polymorphism in gene encoding ADAM33. A metalloproteinase is linked to increased proliferation of bronchial smooth muscle cells and fibroblasts. Clear? Beta 2 adrenergic receptors gene variant. Now, beta, this basically, beta, this image is here from Book Robin. Clear? This is a normal airway. Okay, in this picture, you can appreciate it that this is the epithelium of airway. This is a lamina propria. This is a smooth muscle layer. Okay, and these are the glands. Okay, these are normal airway. And you can compare this picture with this picture, which is seen in asthmatic patient. Okay, in asthmatic patient, in आसान लफ्जों में कि हर चीज बढ़ जाएगी, right? There is a as you can appreciate it that there is a increased mucus layer. Okay, you can compare this with this. ऊपर देखो, इधर देखो, this yellow is okay. This is increased mucus layer. There is increased goblet cells. There is a increased thickness of the basement membrane. Okay, there is increased numbers of inflammatory cells. Okay, there is increased number of eosinophils. Smooth muscles hyperplasia. You can appreciate it. This picture, you can differentiate this picture from this normal picture. Okay, and there is an increased number of mucus gland. Okay, as you can appreciate it that there are few numbers of mucus gland in normal airway, while in asthmatic patient there are a large number of mucus gland. So in morphology of asthma, we can appreciate increased smooth muscle hyperplasia, increased basement membrane thickness, increased mucus layer, increased number of eosinophils. Okay, and this is basically a pathogenesis of asthma. As beta, as we know that in pathogenesis of asthma, immunological factors play a major role. Immunological factors, among immunological factors, type 2 helper T cells play a role, which causes the release of interleukin 4 and 5. 4 is responsible for increased level of IgE, and 5 is responsible for increase the eosinophils. Okay, 5 is responsible for increased number of eosinophils, and these all causes the causes the changes in the asthma, and then it causes the release of acetylcholine, leukotrienes. Now, the environmental factor. The third is the environmental factors. Environmental factors also play a role for the development of asthma. Asthma is basically a disease of industrialized societies. Industrial environments contain many airborne pollutants that can serve as an allergen to initiate the type 2 helper T cell response. Clear? Now, morphology. As I already told you yesterday, that morphology includes gross and microscopical features. Grossly, if in patient dying with status asthmaticus, the lungs are distended. Okay, the lungs are distended by overinflation and contain a small area of atelectasis. Occlusion of bronchi by thick mucus plug. ठीक है, जो ब्रोंकाई के अंदर देखेंगे, अगर आप सक्शन करेंगे तो there is an increased mucus plug. In sputum or bronchoalveolar lavage, there is a Crushman spirals and charcot-laden crystals. ठीक है बेटा, please memorize these two words, Crushman spirals and charcot-laden crystals. Beta, basically a Crushman spirals is result from exclusion of mucus plug, okay, and these are basically due to a shedding of epithelium, okay, shedding of airway epithelium, while the charcot-laden crystals is due to eosinophil breakdown, and it is a combination of eosinophil protein galactin 10. Clear? So beta, these are two components which can be seen in asthmatic patient, charcot-laden crystals and Crushman spirals. Crushman spiral is basically seen in a mucus plug, and these are due to the shedding of epithelium. Okay, and the charcot-laden crystal is basically due to a breakdown of eosinophils and the combination of eosinophils with galactin 10. Clear? These are the crystals. Okay. So microscopically, as I already told you that in asthmatic patient, there is a increase all things of airway, like increase the thickness of basement membrane, smooth muscle hyperplasia, like increased number of eosinophils, increase the thickness of mucus layer, and etc. etc. So microscopically, there is a airway remodeling, thickening of the air wall by thickening of the air wall, subbasement membrane fibrosis due to deposition of type 1 and type 2 collagen, increased vascularity, increase in the size of submucosal glands and number of airway and goblet cells, hypertrophy, hyperplasia of bronchial wall muscles. Airway remodeling gave rise to chronic irreversible airway obstruction. Clear? Now, this is a microscopic image of asthma. And it shows that there is an increased number of eosinophils. Clear? There is an increased basement membrane. There is an increased smooth muscle hyperplasia. Okay. Now the clinical features. The asthmatic patient, the asthmatic attack lasts for several hours. Symptoms are chest tightness, dyspnea, wheezing, coughing. Okay. Status asthmaticus lasts for days and patient gets sinused. Treatment depends upon the severity of the illness. Now, this is all about the asthma. Clear? Now, we will continue the next obstructive lung disease, that is bronchiectasis. Clear? But asthma is clear to all of you. Now, now we start the bronchiectasis. But a bronchiectasis is basically a disorder in which there is a destruction of a smooth muscle and elastic tissue by chronic necrotizing inflammation leads to permanent dilatation of the bronchi and bronchioles. It has become uncommon due to better control of the infection. Okay? Beta, one thing is important in emphysema, air wall की destruction होती है, and chronic bronchitis increased mucus production होती है, and chronic cough is responsible for that. In asthma, immunological response, reversible, chronic condition, type 1 hypersensitivity reaction, and bronchiectasis is basically due to infection की वजह से ज़्यादा रहती है. In which there is a destruction of a smooth muscle and elastic tissue by chronic necrotizing inflammation leading to permanent dilatation of the bronchi and bronchiole. Okay, it has become uncommon due to better control of infection. Clear? Bronchiectasis can develop in association with congenital or hereditary condition, including cystic fibrosis, intralobar sequestration of lung, immunodeficiency state, primary ciliary dyskinesia, and Cartesian syndrome. Beta, this is frequently asked in your SCQ that the condition associated with bronchiectasis or bronchiectasis associated with which one of the following condition. In MCQs, anyone can ask. And you must know that bronchiectasis, you must know all these names, okay? Bronchiectasis is associated with congenital or hereditary condition like cystic fibrosis, intralobar sequestration of lung, immunodeficiency states, primary ciliary dyskinesia, and Cartesian syndrome. Infections like necrotizing pneumonia caused by bacteria, fungi, and viruses. Bronchial obstruction due to tumor or foreign bodies or by means of mucus impactation. Bronchiectasis is localized to the obstructed lung segment. Other conditions like rheumatoid arthritis, SLE, inflammatory bowel disease, COPD, and post-transplantation, chronic lung rejection, and chronic graft versus host disease after a bone marrow transplantation. 1/4 to 1/2 cases are idiopathic, lacking the any association. Here, so bronchitis is basically a disease which is associated with infection and certain condition like cystic fibrosis, like ciliary dyskinesia, like Cartesian syndrome, like immunological condition like rheumatoid arthritis, SLE, COPD. Okay. Now, obstruction of the infection, obstruction and the infection are the major conditions associated with bronchiectasis. Both are necessary for the development of full flash lesion. In cystic fibrosis, beta, anyone can ask what is cystic fibrosis? So in cystic fibrosis, basically the primary defect with iron transport, which and chloride ion, leads to defective mucociliary action and airway obstruction by thick mucus. Okay, in cystic fibrosis, defective iron, chloride ion, and in them there is a ciliary dysfunction and there is a thick mucus formation. This set the stage of chronic bacterial infection, which causes widespread damage to airway wall. With destruction of smooth muscle and elastic tissue, the bronchi become dilated, while smaller bronchi are progressively obliterated by fibrosis. Okay? And the other condition is ciliary dyskinesia, is basically an autosomal recessive syndrome. 1 in 15,000 to 40,000 births. Ciliary dysfunction is due to defect in ciliary motor proteins. ठीक है, dynin की वजह से हो जाता है and contribute to the retention of secretion and recurrent infection that in turn leads to bronchiectasis. Okay, because we know that what we call there is a major role of cilia to clear the mucus. Whenever there is a defect in ciliary motor proteins like dynin, so cilia can't do their function very well, and there is a retention of the mucus, and there is a thick mucus plug. And ciliary function is important in the rotation of developing organs in the chest and abdomen in fetus. And in its absence, the location become matter of chance. Half of the patient with ciliary dysfunction have Cartesian syndrome. Okay, anyone can ask what is Cartesian syndrome? Then you must know that Cartesian syndrome is basically a ciliary dyskinesia, and there is a situs inversus or a partially lateralizing abnormality associated with bronchiectasis and sinusitis. Now, the lack of ciliary function lead to mucus accumulation in the sinuses and bronchi and predisposed to bacterial infection. Male with this abnormality can have infertility due to sperm dysmotility. It can be asked that the patient with bronchiectasis if the patient is male and having a bronchiectasis, then there is a chance of infertility due to sperm dysmotility if it is associated with Cartesian syndrome or ciliary dyskinesia. Clear? Allergic bronchopulmonary aspergillosis occur in patients with asthma and cystic fibrosis who develop recurrent infection may lead to proximal bronchiectasis and fibrotic lung disease. Now, sensitization to aspergillus in the allergic host leads to the activation of type 2 helper T cells. Okay, type 2 helper T cells will play a key role in the recruitment of eosinophils and other leukocytes. High serum Ig levels, serum antibodies to aspergillus. Okay, now, in gross, the bronchiectasis usually affect the lower lobe bilaterally. Okay, it usually involves the lower lobe bilaterally, vertical air passages, and in more severe cases, more distal bronchi and bronchia. Tumor and aspiration of the foreign bodies lead to bronchiectasis in the localized area. The airway in bronchiectasis, the airway are dilated. Bronchi and bronchioles are so dilated that these can be followed by the pleural surface. They reach to the pleural surface. On cut section, bronchi appear cystic and filled with a mucopurulent secretion. Okay, you can appreciate it that this is a gross image of bronchiectasis, a bronchiectatic lung, and it shows a dilated bronchi and filled with a cheesy like necrotic material. These spaces are filled with the necrotic material. And macroscopically, in the full-blown active cases, there is acute and chronic inflammatory infiltrate within the wall of the bronchi and bronchioles, with desquamation of lining epithelium and extensive area of ulceration. Pseudostratification of columnar cells or squamous metaplasia can be seen. Bronchiectasis may be associated with lung abscess, fibrosis of the bronchiole and bronchial wall and peribronchial fibrosis can be seen. Clear? And many bacteria are found in bronchiectasis like staph, streptococci, pneumococci. Clinical course includes severe persistent cough, foul smelling sputum. Beta, this is very specific clue of bronchiectasis that bronchiectasis is associated with foul smelling sputum, fever, infection, okay, certain condition, complication at the col pulmonale, brain abscess, amyloidosis. Okay, so beta, till now we completed our obstructive lung diseases. Okay, from tomorrow, inshallah, we will start the restrictive lung disease. Okay, and please, beta, be prepare your topic of obstructive lung disease from your book, Robbins. And you must know that it is frequently asked about the chronic bronchitis, emphysema, definition, pathogenesis of asthma, okay, factors associated with bronchiectasis, and the clinical features of bronchiectasis like foul smelling, sputum, fever, infection, clear? Or this is all about the obstructive lung disease. If you have any query, beta, you can ask. Ajay.